I'm Dr. Jennifer Hernandez. I'm a maternal fetal medicine specialist here in Mansfield. I consider myself a high-risk pregnancy expert. That's what most people would call a maternal fetal medicine specialist. So we take care of moms and their babies that have a condition during pregnancy that may affect the outcome of the pregnancy. This includes conditions that affect a mom chronically, like diabetes or hypertension. Genetic conditions that run in the family are things that we certainly would counsel a patient on if it could affect the baby in the long run, and babies born or which develop birth defects during the pregnancy. And so we monitor those pregnancies as well. So some things we know about before the pregnancy and some things we learn about during the pregnancy, and that's how they come to us. It's through the obstetrician that identifies these potential problems and sends them to us as the specialist to counsel the patients further and help manage the pregnancy. We usually work in conjunction with the obstetrician and co-manage the pregnancy and help them monitor and manage and make decisions about the pregnancy, especially timing of delivery. But sometimes, occasionally, the pregnancy becomes so high risk that they need to come to us entirely, and we'll take over the care of the pregnancy, including delivery. Certainly, maintaining excellent health before pregnancy is recommended. So optimizing chronic medical conditions like diabetes and hypertension, it's best to come into the pregnancy with those as well cared for as possible. So keeping yourself in good health prior to any pregnancy is our recommendation for everybody. But occasionally it's not that easy, and that's why we are here to help out and optimize the pregnancy outcomes as much as possible. Maternal fetal medicine is growing and definitely evolving. One of the really neat things that we can do now is surgery on fetuses. And so that is actually something that is happening at some of our centers around the country. So if you or a family member has a condition that would be optimized by fetal surgery, we would send you to our specialist colleagues in centers like Houston and Philadelphia. But that is something that's developing and something that we can do now that we couldn't do before. But we can definitely monitor and manage a lot of conditions that we couldn't do before with just high resolution ultrasound and being able to see that baby better than we ever did before. And so there's a lot to come for sure. I knew I wanted to pursue women's health, and so I planned to become an obstetrician and gynecologist after medical school, and I did that residency, and then I fell in love with pregnancy and just wanted to specialize in that. And so we are the pregnancy specialists, and that's all I do day in and day out, and I just wanted to do that for my career. It became a passion of mine, and so I did a fellowship in maternal fetal medicine. It's an extra 3 years of training after an OBGYN residency. And now I love it, and I get to take care of women that need me during their pregnancy. Mansfield is growing, and so is this hospital, and we are building a high-risk pregnancy unit as we speak. So we are planning to have a high-risk unit in the very near future where we can take care of high-risk pregnancies long-term if they need to, so that they don't have to go to another hospital that has those same facilities. So we are growing and taking care of these pregnancies. We have obstetricians and gynecologists. We have maternal fetal medicine specialists like myself. We have a wonderful NICU that can care for these babies after they're born, if they're born for prematurity or if they have conditions that require extra care after delivery. This NICU can handle it. We have social workers and physical therapists and caseworkers that can help anybody with any issue and complication during their pregnancy. So it's a wonderful model here that's growing, and we're prepared to take care of our community and grow with the hospital. I can just tell you 3 to 5% of pregnancies are affected by a birth defect. Certainly the amount of women that are affected by chronic medical conditions like diabetes is growing as the volume of that is expanding. Hypertension is very prevalent. So a lot of women have these conditions that we now are aware of and have the capability of taking care of during pregnancy. And so we are very much able to do that with me and then with my colleagues here in Mansfield. A lot of pregnancy conditions, we are the expert and we take care of those conditions entirely during pregnancy. But yes, certain chronic medical conditions do require a multidisciplinary approach, and those specialists are also here in Mansfield so that we can all work together. I am a twin mom. I have twin boys. They're now 12, and I delivered them here at this hospital 12 years ago. I will never forget that day for the rest of my life, but I remember that moment very fondly coming in. I did have an emergency myself, and so I can tell you that it was handled beautifully, and my children are healthy, thank goodness, because of it. So I would send my friends and family here, and I work here myself, and I'm just grateful for the care that I received and will continue to provide to the community every